it's Leticia here at Pro Touch Esthetics, and I have Tara, our nurse injector. We just have a few questions that we've gotten from our clients that I wanted to post on here and have it answered for everyone. So we'll start with who should get injections, like Botox or fillers?
So it all depends. I mean, the sooner that you start, the better as far as prevention and as far as preventing those deeper lines from setting in. So as soon as you notice that there's some movement there that might be a little bit more than you'd like to see, then it might be time. I had somebody come in today at 25 just because she was starting to notice a line at rest in her forehead and she thought it was time to treat, and that will in turn be better for her in the long run because it will never set in too deeply. So.
And what about for fillers?
Anybody who wants to replace any type of volume loss in the face, to pull up in the cheek area, for some lift in the lower face, obviously lips to plump up the lips. People who want some refreshed look under their eyes, because obviously we know as time goes on we get a little bit more volume loss under the eyes, and that's something that people like to replenish, and then they see that they feel like they've had a good night's sleep. So tear troughs is another biggie.
How often should you be coming in for these treatments?
So on average, Botox lasts about 3 months. Of course, it could last a little longer for some people and a little less amount of time for others, depending on your lifestyle for one. It just varies, but we like to tell people about 3 months. As far as filler goes, typically about 6 months would be the minimum, but we usually see like about a year we can get out of it. So, but in order to, sometimes we need to build. If someone were to have lips that they have a certain goal in mind that they want, they may need to build over the course of time to get to where they want, to their desired look, and then from there, they can just maintain periodically every year.
Yeah. So how long does it take for Botox to work?
So Botox, we see the full effect of Botox at day 14. Every day, usually a couple days after treatment, we'll start to notice less movement in the area, but where it is at 14 days is where it's going to stay. It's not going to get any better at that point. So at that point, we tell people come back and then we can see if there's touch-ups needed. Filler is something that we see right away, but keep in mind that there is quite a bit of swelling with filler at first, so you have to give it a couple of days to kind of settle, but that is an immediate result. You don't have to wait a full 14 days.
And so how old would you recommend somebody to come in for their Botox?
Well, you have to be of age, obviously. You can't be under the age of 18. Again, as far as the minimum age, I would recommend in 20s some baby Botox to just start the prevention process. You can treat up until you're in your 80s. Obviously, the sooner you treat, the better. A lot less work to have to do later on, but there's really no age, as long as you're in good health, obviously, and there's no contraindications, and everything is okay in that way. You can treat into your older age.
So how long before an event should I get my injections done?
You definitely want to consider planning around an event, because there's bruising to keep in mind. There's always a risk of bruising, no matter if you're doing Botox, lips, any type of filler. You always have the risk of bruising, and we can never tell. There's things we can do to prevent the possibility or to lessen it, but there's always a risk. So I would definitely, if you want Botox, I would plan it, since it takes 2 weeks to work, you want to come in at least 2 weeks before, so that by the time your event takes place, you're where you want to be, or even a little bit farther out, because then if you need a touch up, you can come back. So definitely plan accordingly. Don't have an event the next day when you're getting your lips done, because then you're going to bruise, and then swelling. Yeah, the worst swelling is the day after you get your lips done, and then it kind of goes down from there. So yeah.
So what can you do to prevent any of the bruising and things like that?
So we always like to tell patients that you need to stop any kind of aspirin products, Advil, things like that, about a week prior to treatment. Just take Tylenol if needed. You don't want to be on any blood thinners. That will just increase your risk of bruising. Any kind of alcohol, wine, things like that, you want to not do that a couple days before. Arnica is something that you can purchase over the counter at any drugstore, and that could help with bruising if you started ahead of time through treatment, and then about a week after treatment. That really cuts down on the bruising from what my patients have told me. Yeah.
All right, well, thank you, Tara.
Of course.
It was nice having you answer some frequently asked questions that we get here. So
plan your appointments now, just because
Yes.
we're booking up quick for the holidays for injections. Everybody wants to be holiday ready, so give us a call and book those appointments.
we'll see you soon.